Our numbers have gone up to at least 50% of the American people, I believe, have been vaccinated with 2 shots, 70% with 1, for those who didn't take the Johnson & Johnson. But let me be very clear, as this is a continuing map, we are continuing to be a red state, but more importantly, we are 7 states, who have the lowest amount of vaccinations. It is a combination of political leadership that doesn't seem to take this seriously. And I'm going to speak to the first responders who are around the clock bringing people to hospitals, and sometimes the hospitals require them to do a drive-by, means they cannot drop them by. And that means this person may have a heart attack, a stroke, pneumonia, having a baby, or a sick baby that had to be airlifted to Temple, Texas, because we didn't have any bed for the little baby. So this is about 12 states. Let me count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 of us have the highest number of cases. 7 of us, including Texas, what is red, has the lowest amount of vaccinated persons. And we are getting Delta every day. So I am pleased to have one of the leading infectious disease specialists right here in our community. Dr. Peter Hortez and I have been working with each other from West Nile virus, Ebola. He is renowned not only here in this community as Dean of the Baylor School of Infectious Disease, but he is renowned around the nation. I know that he wishes he was not renowned for the enormity of Corona, COVID-19, and now the question of the Delta variant. And so, Dr. Cortez, we're here to fight for masks, mandatory masks, but to have people at least wear the mask voluntarily, and we're here to get the unvaccinated person vaccinated. So it's my pleasure to introduce Dr. Peter Hortez. We're in a crisis. We need to respond to it. Dr. Hortez. Can you hear me?
Thank you so much, Congresswoman. It's an honor to be with you. I'm sorry I'm not there in person, and we've got a lot of COVID issues right here at our medical center, and dealing with a number of those things, as you can imagine.
We understand.
I was hoping to have a quiet summer. I thought that if we had continued to our trajectory in terms of vaccination into April, May, and June, that we would, in July, we would not have to see a big resurgence. But unfortunately, here in the South and a lot of the southern states, including Texas, we stalled. And we stalled for a lot of individuals who became defiant of vaccines or didn't trust vaccines. There was an enormous amount of disinformation out there, and that left a hole, a gap. And guess what's filling it now? This Delta variant, for COVID-19. Let me say a few words about the Delta variant. It's now the overwhelming COVID variant in the United States. Over 90% of the virus isolates are Delta. And it is much more transmissible than anything we've ever seen before. It's at least 2 or 3 times as infectious as the original virus lineage of COVID, which was pretty infectious to begin with. And now the Centers for Disease Control says it's as contagious as chickenpox, which is one of the most contagious virus infections that we know about. And the big problem is this: we actually did not do too badly at vaccinating Americans over the age of 65. Not great, but not terrible. So here in the southern states, around 80% of the individuals over the age of 65 were vaccinated. Not as good as 95, 99% in the Northeast. But as I say, not terrible. The problem is very few young adults are vaccinated now, and very few adolescents. So in many of the southern states, we're seeing fewer than 20% of adolescents vaccinated, 30-40% of young adults. And the Delta variant is exploiting that. So what we're seeing now is, as if you look at a heat map of the United States where COVID-19 is, the hottest part of the country right now is Louisiana, and then going all the way over to Florida. So all of the southern states. And unfortunately, we're seeing a lot of young adults going to the hospital And for the first time, we're seeing pediatric hospitalizations overwhelm the staff. So we really hadn't seen that before. So children's hospitals are filling up all across the South. And for the first time, we're seeing pediatric intensive care units fill up. And that really worries me. I don't think this virus is specifically targeting kids. I just think it's, it's sweeping along in this forest fire of infecting everybody, and kids are getting swept up into it. And unfortunately now our time has come here in Texas, so it's now spreading out into East Texas. East Texas is getting hit very hard right now, and especially some of the rural counties along the Louisiana border, which, as you know, Congress, some just don't have the healthcare infrastructure like we have here in the Texas Medical Center, and our Texas Medical Center is filling up. And the worry, of course, is all of this has to be contextualized with the fact that school hasn't even opened yet. And that's what I'm worried about. So next week, school's open in Louisiana, and here at HISD, Houston Independent School District, I think it's August 23rd. And this will act as an accelerant. So all of the pediatric hospitalizations that we're seeing now, and the pediatric ICUs and hospitalizations that we're seeing, I said on MSNBC this morning with Ali Velshi, this is just a warm-up act. Now we can see this really steep acceleration as schools open, unless we do two things. And those two most impactful things are, one, get everybody vaccinated, including adolescents. Are vaccinating the teenagers aged 12 through 17. That's got to be our absolute priority if we're going to protect them in the middle schools and high schools. And then masks. That's pretty much all. That's our major vaccine. We need everybody masked in the classroom. We need the course the students, but also the teachers, the staff, the bus drivers. This is the only two major tools that we have to fight COVID-19. And I know it's here in Texas especially, where we so value our freedoms, and I get it, I understand so that, but the virus is already telling us what it's going to do. It's told us what it did in Louisiana and Florida. It's telling us what it's going to do in Texas. And now is the time we have to put aside our ideologies. And we don't always have to do that in this country, but now we have to do it. We have to have everybody masked in the classroom. Everybody who's eligible to get vaccinated has to be vaccinated. I'm not a big fan of mandates, but I just don't see a choice. We have to have everybody who's eligible vaccinated, everybody masked, if we're going to give our kids a chance for a good school year. Otherwise, this is going to go very badly. And I'm predicting that if we don't do this, we're going to start seeing pediatric ICUs and hospitals, children's hospitals, get overwhelmed very quickly. And you know what that's going to do? That's going to scare a lot of people and will shut the whole thing down. And that's why I'm here with you and the Congresswoman who's so concerned about this situation. Is to, this is a plea to please stop put ideology out in front of us, put our kids on the road. So I'll stop there, Congresswoman, and I'm happy to take questions however you'd like to proceed.
Thank you so very much, Doctor. And let me, if you would, let me get the question before you have to go, which I think is very important, because I hope you can hear me, Dr. Ortiz. I'm an optimistic person. I have been optimistic since March 19th when I started the first testing site. And I'm even optimistic to vaccine hesitancy. But I'm not optimistic to vaccine complacency. And that is where we are today. And I want it to be known to my constituents, to the city of Houston, Harris County, you just cannot continue to be so complacent while people are dying. So, Dr. Cortez, would you please explain how we protect our children under 12 that are not vaccinated by wearing a mask? Mom and dad, siblings, as children under 12 or toddlers, so maybe at home, or maybe in other forms of child care, and then older siblings not wearing masks, not vaccinated, those who are eligible, who are back and forth in the school system, riding on buses, how that endangers the little ones, like the little baby that had to go to Temple, Texas, because there were no beds. In our own big city, this little toddler had to go to Temple. I do want to acknowledge Mom, who was precious, but Mom admitted she's not vaccinated. Can you tell us how important it is to protect those little ones who have no options right now? Dr. Cortez?
Well, thank you. So, as you rightly point out, Congresswoman, kids under the age of 12 don't have the approvals yet to vaccinate them. We don't have the safety and efficacy data for kids under the age of 12. So here's what we've got to do. We've got to do two things. First of all, let me address the vaccine issue. If all of the adults and all of the adolescents were to get vaccinated in Harris County and Houston, you might say, oh, that's impossible. Well, it's not, right? They've done it in Vermont and Massachusetts.
That's right.
In the Northeast. If you have all of the adults and adolescents vaccinated, that actually slows community transmission and prevents the big surge of virus that we're seeing now in Louisiana and elsewhere. The other thing that does is if the adolescents and adults, including the parents, are vaccinated in the house, they're less likely to transmit the virus to the babies, to the little kids at home. And so those have to be top priorities. The only other big tool we have, of course, are masks, and that's why masks have to be the rule when kids are outside, when kids are out of the home, but in indoor settings, whether it's schools or bringing them to HEB or Kroger's or wherever you're bringing little kids, you have to have them masked when they're indoors because that's where the transmission is occurring. And it's simple, but it's critical. And this is life-saving, and that's what it's all about.
Thank you. Thank you, Doctor. Thank you for your service. We'll continue to work together. If we keep talking, I'm hoping that there will be a victory in the understanding of where we are today. Doctor, that is why on August 4th, I thought it was imperative as the senior member on Homeland Security and as well as the chair of the COVID-19 bipartisan congressional task force on COVID-19, as I said. On August 4th, I sent a letter to Governor Greg Abbott. The words are as follows: I write to urge you to rescind these provisions of Executive Order GA 38, which you issued on July 29th, that prohibits the city of Houston, Harris County, and other local jurisdictions from promulgating and enforcing any mandate that may be necessary to respond to and mitigate the substantial threat to the public health and safety posed by COVID-19 coronavirus pandemic and its Delta variant. To be frank, the executive order does not do anything but possibly consigns thousands of Texans to needless death and suffering because of the inability to provide reasonable requests to wear masks. Children who are unvaccinated, as well as employees, law enforcement, first responders, store owners, and regular citizens who are here in our community. The Delta variant is the most contagious and it can be the most deadly. I respectfully ask the governor to consider my request in my letter, but more importantly, don't consider any letter. All you have to do is to indicate that if a particular jurisdiction decides that because of medical emergencies, because of the catastrophic circumstances of Delta virus, has to issue a mandate that you will waive any penalties regarding the executive order. Yes. That's what we need. You'll waive any penalty because I can assure you it's about saving lives. Right. Governor Abbott, I want you to know that hospitals in Harris County have indicated that they're at a catastrophic internal condition, internal catastrophe. Internal devastation is a terminology that deals with hospitals that are oversaturated with patients. You never want to say you're oversaturated, but without the staff and or beds to take care of them. This has been brought on by the large numbers of patients who are walking in. Some are coming in the ambulance who are infected with the COVID-19 variant Delta, the Delta variant. And they're coming into the hospitals very sick, needing hospitalization. These are not patients who are vaccinated who can go home and take care of themselves. These are unvaccinated patients right here in Harris County who are coming in very sick. This letter is a lifeline to help our local jurisdictions, our hospitals, our school boards. Thank you to HISD that is now going to be voting to save lives and the children. We've heard Dr. Cortez say that children who are under 12 that can't be vaccinated, then we realize that we've got to do something to protect them. Why is that baby infected with COVID-19? The baby got it from somewhere. The infant got it from somewhere, and that baby had to be sent to Temple, Texas. The story was told far and wide, but it needs to penetrate. And we're here. I want to cite, this is a wonderful complex. It's part of the Houston Housing Authority, but the complacency is deadening. The silence is deadening. I won't call the name of where we are, but it's deadening. And there are people here that have children, the age of 12 and older. There are young people in these apartments, and they have chosen to be complacent in order to jeopardize their lives and the lives of others. I hope they hear me, because it is really sad. That's the terminology I'll use. Sad that you won't stand up and save your own life. So I've asked the governor. I also have a letter that we're using in Congress. The letter in Congress says that the Centers for Disease Control issued guidance to all individuals, both vaccinated and unvaccinated alike, to wear a mask in indoor spaces to further reduce spread of delicate agents, coronavirus, in the areas of the United States characterized by elevated risk of disease transmission. The indoor mask requirement for both vaccinated and unvaccinated individuals has already been enacted by local governments in selected regions of the United States. Everyone that can possibly tell you are telling you, one, to get vaccinated, and two, to wear a mask. The numbers that you can see, Mark, if you can turn it around to the camera here. Again, those red states are continuing to increase. And not only that, there are 7 states, and Texas is along with the southern states, that are continuing to be deadly. Louisiana, Alabama. By the way, that number is only talking about the 500,000 cases. That's the coloration. But Texas is on the list as a state with the largest number of Delta infections in the United States. There are 7 states, and they include states like Louisiana and Alabama. Everybody should understand, we're now lumped with this sophisticated state with a major infrastructure in places like Harris County of health protocols. We're now one of the states that are suffering. And then people won't even wear a mask that we're giving away today. We're giving these masks away today. We thank the National Association of Christian Churches. We're giving away these masks. Free masks. We may have to go door to door to give them to them. And we don't believe in little bottles of sanitizer. We're giving away a big old bottle of sanitizer. So you have it in your house, and as soon as you walk in, you put on the sanitizer. You walk around, you put on the, utilize the sanitizer. Not put on. I got a smile. You utilize the sanitizer. All right? I'm getting my muscles here. Utilize the sanitizer. I hope this young lady walking by is vaccinated, because we're vaccinating people here with Pfizer. But this is the complacency that is absolutely overwhelming. I'm delighted, however, to salute our first responders. Delighted to have Dr. Naqvi, Ali Naqvi, who is working in the UT Physicians Clinic. He sees children on a regular basis, but he knows what we're going through right now. Dr. Naqvi, thank you very much.
Welcome. Thank you. Yeah, so I'm a pediatrician in this very community, and unfortunately, as we all know, we have been seeing a huge number of kids coming with COVID-19 infection, and they are from all ages, from like newborn to any age possible. Wow. So, and obviously it's very clear and obvious the best chance we have of protecting those young ones is to wear a mask, and if we are all protected around them, all adults are vaccinated, so that's how we can prevent them from getting COVID-19 infection. So we do have plenty of vaccines. We have many of these events like this going on. So please take advantage of these opportunities and you all get vaccinated.
Thank you so much. We'll take questions if he has questions. And I'm so glad to be here with our wonderful elected officials as well. First, I'd like to bring forward a courageous advocate for children, and that is Trustee Kathy Buford Daniels of the HIC School Board.
Thank you, Congresswoman, and thank you for your leadership in ensuring that people were tested first and continuously, and now for vaccination. So I ask if you are within the my voice, those of you that are sitting around. I am the HIC trustee. We will be starting school August 23rd. And let's just say our children, our black and brown children primarily, have been the most affected. Our black and brown communities have been the least vaccinated. Our black and brown communities tend to have multiple families living together. So I urge you all, please, if you're 12 and up, get vaccinated. We want our babies in the classroom. That's our biggest commodity. We love our babies and grandbabies, and just like we love our babies and grandbabies and want to keep them safe, the teachers, staff, bus drivers, cafeteria workers, their families want to keep them safe as well. So please, don't wait, vaccinate.
Oh, we thank you so very much. I hope this young man is coming over here to get vaccinated, or get someone vaccinated with the red shorts on. All right. I sure hope he's walking in this direction.
All right.
I don't know. Please, I hope he's coming to get vaccinated. I see someone coming in a car. Come around, sir. Are you coming to get vaccinated?
All right.
Oh, all right. Come on over here, sir. You got some beautiful children. I'm just going to have you say your name and let you go right back there to get signed in. What's your name, sir?
Oscar Joseph.
Mr. Oscar Joseph. How old is this young man here?
My name is Bryson.
Bryson? Oh, that's a handsome name. And how old are you? 10. You got to wait, but if he gets vaccinated, you, and that's your name, I got you. Beverly and Bryson are going to be protected.
That's right.
Thank you so much, Dad. They're waiting for you back here. Come back and talk to us when you get through, because with those muscles on your arm, you're going to be laughing all the way through. All right. We are glad. We got someone else coming to be vaccinated?
You got some behind you too, Congressman.
All right, let's wait with them. Getting vaccinated? Come on up here. Come on, sweetie.
And her daughter.
We'll be quick. Don't have to take it off. Just what's your name, sweetie?
LaShaydra.
All right, you coming to be vaccinated.
Yes, ma'am.
Mom, and how old are you?
14.
And what's your name?
Cherish.
When you all come out, I'm not going to let you go by. You grab them because we are proud of them.
Yes.
All right? I've been talking about you, and here you come. You know, this is one person at a time. I really hope, I'm being very honest, that media can edit, but I hope they show this because there's too much complacency. It's just too much.
Yes.
Let me introduce Ms. Eaton, who represents a great leader, our council member, the council member for District B, Councilmember Jackson.
Thank you so much, Congresswoman, for all of your efforts and everything that you've done.
Yes.
I also want to thank our trustee for being so vocal and adamant about the mask mandate and making sure that our children are getting vaccinated. Me and the trustee were actually just leaving from Kashmere High School, where they are actually participating in the Mayor's Super Saturday Vaccination event, which is going to be taking place every Saturday within the month of August, and we are incredibly serious about making this happen.
Yes.
But my sentiments are exactly the same as Congresswoman. The complacency is appalling at this point, and I can speak on behalf of Councilmember Jackson and say that we need to get vaccinated as soon as possible. A few numbers from the City of Houston Health Department we heard from Director Williams this morning is that in the African American community, you have a little under 25% of African Americans that are actually vaccinated, and in the Latinx community, it's a little right at 30. With that being said, I can say for the District B office, we are 100% vaccinated. I know for your mayor for the city of Houston, he is vaccinated. I know that for a lot of the positions that you have seen before you with Congresswoman Lee, they have been vaccinated. Congresswoman herself is vaccinated. So for those who are still apathetic, for those who are still skeptical about how this vaccine works and how it is safe, please know that your leaders are taking every step to make sure that we are safe, so that way we can continue to serve you, and we are asking you to do the same. So please reach out to our office. We stand ready to partner with every single office, be them government, nonprofit, church, civic association. We want to make this variant disappear as quickly as possible, and the only way we can do that is through vaccination. So thank you guys so much, and thank you again, Congresswoman.
Thank you. I think somebody heard that I was crying out here. They didn't want me to keep crying. Come on, dear, so we can just call your name out. Here you are, right here. Just walk over. All right. You're making me not talk about this great place where you live. What's your name? Bianca. Bianca, you coming to get vaccinated? Give her a hand. All right. Those are stark numbers. Under 30% of the Hispanic and African American community. Let's add greater insult. 435,000 cases in Harris County and almost 7,000 dead. 6,745 have died in Harris County, which is a little under 10%, I think, a little under for this huge number, a little under 4% or so. But the point is that is like 7,000 dead. And let me tell you these numbers, as I said, 50% of Americans have 2 shots, but that's only 50%. 50%. But look at the largest share with African Americans and Hispanic. But let me also tell you, as an example, Salt Lake area, cases rise in Delta variant. So all over America, the cases are rising. Last week we fought as hard as we could for a moratorium on evictions. Federal funds are $46.5 billion. Well, here's what the Biden administration did. Because the members of Congress, my colleague, they issued a new eviction moratorium. It's existing right now on October 5th. They had to do it and to overlook the Supreme Court because they decided that there were catastrophic health issues, emergency health issues with the Delta variant going up. The Delta variant going up. And that's how we were able to issue the eviction moratorium. But is that a good idea? No, the moratorium is a good idea, but the idea that the Delta variant is rising is very sad. And all I can do is beg my fellow neighbors to come out. Now let me do this before I introduce the... let me do this before I do the Houston Housing Authority and to others that are here as well. And I understand we have, all right, and thank you so very much. We're going to give you a very big hand. She's getting vaccinated. Thank you. I'm going to bump your hand. There we go. All right, thank you. Was somebody with her? Okay, thank you so very much. We are blessed to have, we knew if we stayed here long enough, we'd get all the good people to come. Miss Betty? Miss Betty? Look what we're going to, these are some more masks. Can you put that in there? And we're going to give you, all right? You can't carry it, but they'll carry it for you. All right, that's sanitizer. It'll keep your hands clean, all right? All right. And she's got some food over here as well. So let me do this. Dr. Not me indicated, I wanted you to hear that. He said that these children are sick. Children can die. So this little girl has been all over national TV. She's been all over national TV. She's 11 years old. She could not get the vaccination at this point. But someone gave her COVID-19. And she's dead. She couldn't make it. I'm using her because she's already been exposed on national television. She's dead. Do I need to speak to the issue of complacency anymore? Do I need to ask the governor to please waive the mandate prohibition so that children can go back to school and school districts can help children be safe? Governor, I'm asking you to do it voluntarily. I'm asking you to read my letter. I'm asking you to see what's happening here in Harris County. And as Dr. Cortez said, East Texas. And I'm asking you to listen to the numbers of the low numbers of vaccination among diverse populations and young people of all populations. This little girl is dead. I just hope in her name, this real precious little girl, turn it around forward, that we can, children hospitalized with COVID-19 up 175% in the last 6 weeks. I'm not taking anything from anyone, but I'm reading what has been documented. So Mark, thank you for having us here. I'm not happy with the complacency, but I see some folks starting to come out. But complacency has got to end if we're going to save lives. Mark Field is the president, CEO of the Houston Housing Authority. We've been working together, and I believe in what his mission is, and we'll continue to have the opportunity to work with him to be wherever we can, to reach out and knock on doors to get people to understand that they have to save lives. When these children go back to school, it's going to be too late. It's going to be too late for going back if you're already infected and you didn't wear a mask, and the school districts are not allowed to put up a mask. It's going to be too late. Mark Field. And then we'll take questions.
Congresswoman, I cannot thank you enough for your laser-like focus on our health. The Congresswoman has been absolutely tireless, and I very much appreciate your straight talk. This is deadly serious.
Yeah, it is.
It's deadly serious. You just, if your heart's not breaking, you're not human. Simple things. The vaccination is free and it's right there. Free and it's right there. Masks are free, they're right here. Sanitizer is free. And you can work out with it.
Yeah, that's right.
So much you're giving away. And we get it. One at a time. But that's not enough. I stand with the Congresswoman in terms of calling out to the governor. This is a moment to take strong steps. Strong steps, they're easy steps. Mask up, keep washing your hands, social distance, get tested, but most of all, take a few minutes, get vaccinated, if not for yourself, for your children. Thank you all for supporting this. It's always a team. Thank you, Congressman.
Thank you. I don't want to call this little girl, thank you, Mark, for your passion. I don't want to call her a little girl. Her name is Christian Clark. And last week she was alive. This week she's not. So we're just here to stop the dying. And my final words to our governor, Governor Abbott, is to lift the executive order or waive it. And there will be some who will not want to have a mandatory mask. That will be their privilege. But at least those communities that want to implement mandatory masks will not be subjected to penalties because no one is here for a fight. They're really here to save lives. I'm not here for a fight. I'm here to save lives. I'm here because my heart breaks. I'm here because people are loaded up in hospitals. Now let me bring forward the CEO and president of UMC. I hope he didn't, he's on the phone. Saeed, I want to thank him because this little hospital is vaccinating almost across America. They're vaccinating across this community. They're vaccinating across the state. They're vaccinating senior citizens. They're vaccinating teenagers. On the Super Saturday, they were vaccinating in the schools. But I think you should also understand that they're part of a hospital system And generally speaking, without speaking specifically, they have patients in ER, in hallways, being taken care of. Let it be very clear, being taken care of. They're getting COVID-19 patients even from other hospitals. They're working hard. And we know that Harris Health is working hard. They're suffering because they've got so many patients. We know the medical center is working hard. They've got so many patients. I think Dr. Nakvi indicated you have a lot of patients. Dr. Hortez said the medical center has a lot of patients. And Dr. Hortez spoke very calmly. He said he thinks it's just going to get worse. If we don't mask up and vaccinate, it's going to get worse. I know family members who are home with COVID-19. When I say family members, people I know who happen to be family members, and they are home with COVID-19. Thank you, Saeed. We thank you so very much.
Thank you, Congressman.
And we ask you to say a word about how.
Good afternoon. First of all, thank you so much, Congressman. And I personally believe that UMC would have not able to done any what we have doing without Congresswoman.
That's right.
She brought us, she approached us when the first pandemic started, and she was always a driving force behind us to give us the guidance and help us.
That's right.
Having said that, I have heard Dr. Juarez and other physicians and Congress have emphasized on vaccine and mask, and she has been a champion for that. And she's been saying, before even scientists has been saying that, mask up and vaccine. And she was a champion for the testing.
Which we need to still do.
So we need to also emphasize on continue to do testing. Please do not feel that if you have tested 6 months ago, you are good to go.
That's right.
You could be tested today. If you feel any flu-like symptom, please get tested. Or if you feel any different in your body, please get tested. It's very important. Having said that, thank you so much, Congresswoman. Thank you. Thank you so much.
Thank you. We will take questions at this moment. I do want to just conclude my remarks. We meet every week and we vaccinate every week while the rest of the vaccination centers are open. We applaud them for being open, but we do this because when we come home and see the numbers that Ms. Eaton has spoken of, that the Chief Medical Officer for the City of Houston has spoken of, we know it's beach time, we know it's backyard time, we know it's summertime. Beach time, backyard, and summertime. But the complacency is killing you. It's killing you. In the name of this little girl, Kirsten Clark, who none of us know, but in the name of Kirsten Clark, in the name of babies that are in the hospital, in the name of toddlers that are in the hospital, in the name of 11-year-olds like Kirsten that were in the hospital and just couldn't survive, we ask that you get vaccinated. We see the folk coming. I see a group of people standing there with a green shirt on and whatever. I hope that you're vaccinated, because come on down. We've got a whole bunch of things to give you if you get vaccinated.
We got one right here, Congressman.
And then somebody else coming. Great. Thank you, ma'am, for coming. We appreciate you very much. You're making my day. All right. We'll take any questions, sir. All right. Well, let me conclude my remarks again. I'm asking for the governor to lift the mandate or to provide a waiver for anyone that feels because of the present emergency that they have to be able to utilize the mask mandate. The Office of Attending Physician, who has read the CDC or the CDC requirements, are now issued that says that masks should be worn by people vaccinated and not unvaccinated indoors. And so that is, in essence, a recommendation or requirement. The Secretary of Defense is considering having all military personnel wear a mask, even if they're not, I believe, in a high-density area. The federal government has implemented the mask back for federal workers inside buildings. What more do we have to say to you? It's not about a question of freedom. We love our freedom. This is a democracy. We survived January 6th. This is about saving lives and saving the lives of innocent persons like the children that I'm looking at who can't fight off the virus because they can't get vaccinated yet, and the only people they can rely on is the adults in their family, in their life, that can get vaccinated safely. And even if you have underlying condition, or you're a survivor like I am, you can get vaccinated and be standing, but you will not get vaccinated and truly you will be standing, not strongly. And I don't want to finish the sentence as to what else you may happen. So again, thank you very much to all of you, and thank you to the House Attorney. Doctor, thank you so very much. No question for the doctor. Thank you very much for being here, and thank you to the UT Physicians Clinic that are in my congressional district. Thank you to UMMC, the volunteers over there, thank you. And I'm going to go use my strong arm to try to give out the sanitizer, okay? Sanitizer is pretty heavy. Thank you to Knocker as well. And thank you to my truck driver over there and the people who thank you. All right. Thank you very much.